Your fingernails just revealed something your last blood test missed. And after 65, that gap between what your nails know and what your doctor has checked could be the most dangerous space in your entire health picture. Millions of Americans over 60 are walking around right now with clear, visible warnings printed right on their fingertips, and they have no idea. Not because the signs are hard to see, because nobody ever taught them how to look. Here is what shocks me most after 15 years of working with seniors. The changes that show up on your nails often appear weeks, sometimes months, before a condition becomes diagnosable through conventional testing. Your body is sending the signal. The question is whether you know the language. And stay with me, because what I am going to share at number 1 on this list is something I consider one of the most underestimated early warning systems in the entire human body. Research out of dermatological institutions has found that a specific nail change I will describe today correlates with a condition affecting nearly 1 in 3 Americans over 65, and almost nobody connects the two. That connection could genuinely save your life. I am Dr. Elizabeth Carmichael, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have helped thousands of men and women over 60 identify the subtle shifts in their bodies that conventional checkups often miss. What I am about to share is not meant to frighten you. It is meant to empower you. Because knowledge is the first step toward protection. So let us talk about what your nails have been trying to tell you. And let us start from the beginning. After 60, your nails change. That part is normal. They grow more slowly. They can become thicker or thinner. Slight ridging can appear as part of the natural aging process. But here is where most people, and honestly, many physicians who are not focused on geriatric care, make a critical mistake. They attribute every nail change to aging. They stop looking for the signal buried in the noise. The nail itself is a window. It is made of keratin, the same protein found in your hair and the outer layer of your skin. But what makes nails uniquely valuable as diagnostic tools is their blood supply. The nail bed, the pinkish tissue visible beneath the nail plate, is rich with capillaries. These tiny blood vessels reflect the state of your circulation, your oxygenation, your nutritional status, and your organ function. When something goes wrong internally, that capillary network often shows the change before your symptoms do. According to research published in the Journal of the American Academy of Dermatology, over 40% of systemic conditions in adults over 60 produce observable nail changes at some point in their progression. 40%. That means nearly half of serious health issues affecting seniors leave a visible fingerprint on the fingernail, and most of those fingerprints go unread. Here is what terrifies me most. I have had patients come in for unrelated appointments, and I have noticed a nail change that sent us down a diagnostic path we would never have gone down otherwise. In 2 cases over my career, that path led to catching a serious condition early enough to change the outcome entirely. Not because I ran a special test, because I looked at their hands. Today, I am going to teach you exactly what to look for. We are going to go through 7 nail warning signs ranked from least critical to most urgent. By the end, you will know how to read your own nails, and you will know exactly what to do if you see any of these changes. Before we go further, let me ask you something. Hold up your hands right now and look at your nails. Not just a glance. Actually look. Do your nails look the same on every finger? Is the color uniform? Are the surfaces smooth? Or do you see ridges, pits, or discoloration? If you see anything that concerns you, type nails in the comments below. I want to know how many of us are paying attention. Sign number 7, yellowing of the nail plate. Yellow nails are the most common nail change I see in patients over 65, and they are also the most frequently dismissed. The most common explanation offered is nail polish staining, or just age. And sometimes that is exactly what it is, but not always. When the entire nail, or multiple nails, takes on a yellow tint without any history of nail polish use, And when that yellowing is accompanied by a nail that has thickened slightly and seems to grow more slowly than before, you may be looking at something called yellow nail syndrome. This condition, documented extensively in the Journal of the American Medical Association, is associated in older adults with lymphatic insufficiency, chronic respiratory conditions including bronchitis and bronchiectasis, and in some cases, thyroid dysfunction. The mechanism is straightforward. The lymphatic system, which drains fluid from your tissues and plays a key role in immune function, runs channels that feed the nail bed. When lymphatic flow slows significantly, as it can in cases of chronic respiratory inflammation or systemic lymphedema, nail growth rate drops and the nail plate develops a yellowish cast from the buildup of the protein lymphocyte deposits. A 2019 study published in the journal Respiratory Medicine found that among adults over 60 presenting with yellow nail syndrome, 34% had an undiagnosed or underdiagnosed chronic lung condition contributing to the change. That is more than 1 in 3. Now, before you worry, isolated yellowing on one nail, especially a toenail, is most often a fungal infection and is not the same presentation. Fungal nail infections are common after 60 and very treatable. But when you see yellowing across multiple fingernails simultaneously, that warrants a conversation with your doctor. Pro tip: look at the lunula, that small white crescent at the base of the nail. In yellow nail syndrome, the lunula often disappears or becomes obscured. If the yellowing is paired with a missing or indistinct lunula, that is a more meaningful signal. But that is just the beginning. Let us move on to sign number 6. Sign number 6. Pitting and small dents on the nail surface. Nail pitting looks like someone pressed a tiny pin into the surface of your nail repeatedly. You might see 3 or 4 small indentations, or you might see dozens. These pits are not random. They are the result of abnormal keratinization, a disruption in how the nail cells form as they grow out from the matrix beneath your cuticle. After 60, pitting that appears for the first time on multiple nails should prompt a conversation with your physician. In senior populations, the 3 primary associations are psoriasis, psoriatic arthritis, and alopecia areata. According to the National Psoriasis Foundation, up to 50% of people with psoriasis have nail involvement. And in some individuals, nail pitting is the first visible manifestation, appearing before any skin changes. What makes this particularly important in seniors is the arthritis connection. Psoriatic arthritis is a progressive inflammatory condition. Catching it early, before significant joint damage accumulates, dramatically changes the long-term outcome for mobility, pain levels, and independence. A 2021 study in the Journal of Rheumatology found that in adults diagnosed with psoriatic arthritis after age 60, the average time between the first appearance of nail pitting and the formal diagnosis was 2.4 years. That is more than 2 years, during which the body was already sending a clear, visible signal. The practical step here is simple. If you notice pitting that is new and appears on more than one nail, photograph it. Date the photograph. Bring it to your next appointment. You are giving your doctor information they would not otherwise have. Now let us go to sign number 5. Sign number 5, clubbing of the fingertips. Clubbing is a change where the fingertip itself becomes enlarged, and the nail curves downward around it like the back of a spoon turned over. When you look at the finger from the side, the angle between the nail and the skin at the base of the nail actually reverses. Instead of an angle that opens upward, it closes down. This is one of the more serious signs on this list, and I want to be clear about something. Mild clubbing can be congenital, meaning some people are simply born with fingers that have a slightly bulbous appearance. That is not what we are talking about. We are talking about clubbing that develops or progresses after 60 or that you or your family members notice for the first time. New onset clubbing in older adults is associated with a number of significant conditions: chronic low oxygen levels from pulmonary disease, certain inflammatory bowel conditions, liver cirrhosis, and, in a meaningful percentage of cases, lung cancer. The American Cancer Society notes that clubbing is one of the perineoplastic signs of lung malignancy, meaning it is a body-wide response to a tumor process, sometimes appearing before the tumor is large enough to cause respiratory symptoms. The physiological mechanism involves hypoxia-driven changes in blood flow to the fingertips. When tissue oxygen levels are chronically reduced, the body increases vascularity at the extremities. Over time, this expanded blood supply combined with connective tissue changes produces the characteristic clubbed appearance. I am not sharing this to cause panic. I am sharing this because early detection of lung disease of any kind, and especially early-stage lung cancer, is one of the most powerful determinants of outcome. If you notice new clubbing, that is not something to monitor for 6 months. That is a conversation to have at your next appointment, framed clearly. Tell your doctor, I have noticed a change in the shape of my fingertips. I want to make sure we rule out anything serious. Let me tell you about a patient of mine. Robert was a 71-year-old retired machinist from Chicago. He came in for a routine blood pressure check, and his wife mentioned almost casually that his fingertips had started looking different to her, sort of puffy at the ends. She had noticed it over the previous several months. Robert himself had not thought much of it. He had attributed it to the arthritis he already knew about. When I looked at his hands, I saw clear early-stage clubbing. We ordered imaging. A small peripheral lesion was found in his right lung, stage 1. Because we found it when we did, Robert was a candidate for a minimally invasive surgical procedure with curative intent. I received a card from his wife 3 years later. He was gardening again. He was teaching his grandson woodworking. He was fine. This was not a miracle. This was a visible sign that his body had been showing for months, a wife who paid attention, and a physician who looked. If you are finding this information valuable so far, please hit the like button right now. And think about who in your life needs to hear this. A parent, a sibling, a close friend. Share this video. The information I am sharing today is the kind of thing that creates those moments. Someone sees this, checks their hands, and it changes everything. Sign number 4. White spots and bands across the nail. Most people have heard that white spots on the nails mean a calcium deficiency. I need to correct this because it is one of the most persistent myths in popular health culture, and it leads people to either ignore a real signal or self-supplement unnecessarily. Small, scattered white spots on fingernails are almost always caused by minor trauma to the nail matrix. A bump, pressure from footwear, even vigorous manicuring. These spots are benign and grow out with the nail. They are called leukonychia punctata, and in most cases, they mean nothing at all. What is different and what matters is a specific pattern called Meese lines. Meese lines are transverse white bands that run completely across the nail from one side to the other. Unlike trauma-based white spots, these bands are horizontal and affect all nails simultaneously in a similar position. They reflect a systemic event, specifically a period during which nail growth was chemically disrupted. Historically, Meese lines are associated with arsenic poisoning. But in contemporary medicine, the more common causes in seniors include chemotherapy, severe systemic illness, nutritional deficiency states, and importantly, renal failure. A 2020 study in the International Journal of Dermatology found that among dialysis patients over 60, a high percentage showed nail banding changes consistent with chronic renal stress. There is a related presentation called half and half nails, also known as Lindsay's nails, where the proximal half of the nail is white and the distal half is pinkish-brown. This specific pattern has a strong documented association with chronic kidney disease in older adults. The mechanism involves uremic pigment deposition affecting the nail bed vascularity. The key distinction is this. Multiple bands across multiple nails, especially if you have had a recent illness or treatment, is worth documenting and discussing. A white band pattern that divides your nail into distinct color zones, even if it does not bother you, is a specific and meaningful observation to share with your physician. Pro tip: when you describe nail changes to a doctor, describe exactly which nails are affected and where on the nail the change appears. That specificity dramatically narrows the diagnostic possibilities and makes the conversation much more productive. This brings us to sign number 3. Sign number 3, dark vertical lines or streaks under the nail. Let me be direct about this one because it carries more weight than almost anything else on this list. A dark vertical streak running from the base of the nail to the tip, within the nail itself rather than on the surface, is called a longitudinal melanonychia. This streak, which can range from brown to black, is caused by increased melanin production in the nail matrix. In darker-skinned individuals, longitudinal melanonychia affecting multiple nails is very common, often normal, and rarely concerning. But in fair-skinned adults, particularly those over 60, a new or changing dark streak on a single nail is something that requires prompt medical evaluation. The reason is subungual melanoma. Melanoma of the nail unit is one of the most commonly missed skin cancers in older adults. Unlike cutaneous melanoma, which most people recognize as a changing mole on the skin, nail melanoma is often dismissed as a bruise or a simple dark streak. According to the American Academy of Dermatology, melanoma of the nail unit makes up approximately 3% of all melanomas in Caucasian populations. But that percentage rises significantly in patients who are diagnosed late because the presentation was not recognized early. The features that warrant immediate attention are a streak that is wider than 3 millimeters, a streak with irregular borders rather than clean parallel edges, darkening of the skin around the base of the nail, called Hutchinson's sign, and any streak that has changed in width or color over a period of months. I have a very clear rule in my practice. Any new dark streak on a single fingernail in a fair-skinned patient over 60 gets a referral to dermatology for evaluation. Not eventually. Within the month. I remember Susan, a 78-year-old retired librarian from Boston. She came in for a cholesterol review and mentioned almost apologetically that she had this dark mark under her thumbnail that she had been meaning to ask about for a while. She had had it for about 8 months. She assumed it was from a door hinge incident she vaguely remembered. When I looked at it, the streak was about 4 millimeters wide. The borders were irregular. There was very faint discoloration at the cuticle. I referred her immediately. The biopsy confirmed early-stage subungual melanoma. She had surgery within 6 weeks of that appointment. Today, 5 years later, she is cancer-free. She told me after, "Doctor, I almost did not mention it because I thought you would think I was wasting your time." I think about that often. She almost did not mention it. Please never feel like you are wasting your doctor's time. Your observation might be the most important thing said in that room all day. If you believe what you have heard so far could help someone you love, type yes in the comments. And if you are skeptical, type 0. Let us see where this community stands. I read every single one. Sign number 2, spoon-shaped nails, what doctors call koilonychia. Spoon nails are exactly what they sound like. The nail, instead of curving gently downward as it grows out, curves upward at the edges, creating a concave shape like a tiny spoon. If you placed a drop of water in the center of the nail and it stayed there, that is a spoon nail. In children and young adults, koilonychia is most often associated with iron deficiency anemia, but in adults over 65, the picture is more complex. While iron deficiency is still a primary association, spoon nails in seniors can also indicate hemochromatosis, a condition of iron overload, thyroid disease, and Raynaud's phenomenon, a circulation disorder affecting the small blood vessels of the fingers. According to research published in the British Journal of Hematology, koilonychia is present in a statistically significant percentage of adults over 65 with undiagnosed iron deficiency, even in patients who do not yet have overt anemia. This matters because iron deficiency in seniors often presents insidiously with fatigue that is attributed to age and without the dramatic symptoms of frank anemia. The practical implication is this: if you see spoon-shaped nails developing, or a family member notices that your nails seem to be curving the wrong way, that is a specific, actionable finding. A simple blood panel checking ferritin, serum iron, and thyroid function is a low-cost, low-burden test that this finding directly justifies. The empowering reality here is that if iron deficiency is the cause, it is completely correctable. Diet changes, supplementation under medical guidance, and in many cases, the nail shape begins normalizing within 2 to 3 months of addressing the deficiency. Here is my challenge to you right now. Lay your hand flat on a table and look at your nails from the side. Is the center of each nail convex, meaning it rounds upward, which is normal? Or does any nail appear flat or slightly concave, dipping in the middle? If you see that dipping shape on more than one nail, write it down, mention it, act on it. I want to tell you about Dorothy. She was 68, a retired postal worker from Denver, and she had been feeling tired for almost 2 years. Her previous doctor had attributed the fatigue to her age and the natural change in sleep patterns after retirement. She had accepted this explanation, as many of my patients do, because she did not want to seem like she was complaining. When she came to see me for the first time, I noticed during the intake that her nails looked different. 2 of them had a distinct spooning. I ran a full panel. Her ferritin was critically low. Her serum iron was depleted. She had been running on empty for 2 years. We started her on a targeted iron supplementation program with dietary adjustments to improve absorption. Within 4 weeks, she told me she was waking up without the fog. Within 3 months, she was walking her neighborhood every morning for the first time since her husband had passed. She told me, "Doctor, I thought this was just what getting older felt like. I had no idea I could feel this again." You are not broken. What is often broken is the information you have been given. Your body wants to function well. It just needs the right raw materials. Before I reveal the #1 sign on this list, I want to make a quick request. If what you have heard so far is giving you information you wish you had had years ago, I am asking you to do 2 simple things: subscribe to this channel and share this video. Think about the person in your life who watches these for their parent or for themselves. A tap of the share button right now is how you become the person who made a difference. Do not wait. Do it now. Sign #1, changes in color, texture, and speed of the nails all happening together. I saved this for last not because it is the most frightening, but because it requires the most explanation, and because it is the one I believe has saved the most lives in my practice. There is a pattern I have come to call the triad of systemic stress. It is not a single nail change. It is 3 changes occurring simultaneously, sometimes gradually, across multiple nails at once. The nails are growing noticeably slower. The nails are becoming slightly more brittle or thicker, and the color of the nail bed, that pink area beneath the nail, is either paler than it used to be or has developed a slight bluish or dusky tone. Individually, each of these changes has an explanation that sounds reassuring. Together, they tell a very different story. When nail growth slows significantly, that is a metabolic signal. After 60, nails do grow somewhat slower, but a dramatic deceleration, where you used to cut your nails every 2 weeks, and now it is more like every 4 or 5, signals something broader. Thyroid function, peripheral vascular status, nutritional availability. When nails become more brittle or thickened in texture, that often reflects a combination of reduced protein synthesis, hormonal changes including thyroid and adrenal shifts, and in some cases, chronic medication effects. Certain commonly prescribed medications in seniors, including diuretics and some antifungals, can affect nail matrix function. But when the nail bed color shifts, that is the circulation alarm. A pale nail bed suggests reduced blood flow, potentially anemia or arterial compromise. A bluish or dusky nail bed, what clinicians call cyanosis at the nail bed, suggests that the blood reaching the fingertips is lower in oxygen than it should be. This can occur because the lungs are not oxygenating well. It can occur because the heart is not pumping efficiently. It can occur because there is arterial disease narrowing the pathways. A 2023 study published in Frontiers in Aging found that in community-dwelling adults over 65, the combined presence of two or more of these nail changes was associated with a 58% higher likelihood of having at least one undiagnosed cardiovascular or metabolic condition. 58%. Not a trivial number. And here is what I consider the most important practical point of everything I have told you today. This triad is observable. You do not need a stethoscope. You do not need a blood panel. You need your own two eyes and the knowledge of what you are looking for. Let me tell you about James. He was 76, a retired high school principal from Philadelphia. He came in for a knee issue, and I noticed several things in the span of a minute. His fingernails had thickened. The growth pattern his wife described sounded slower than normal. And when I pressed on his nail beds and released, the return of pink color took slightly longer than expected, what we call prolonged capillary refill time. I asked him directly how his energy had been. He paused. He said he had been more winded on his morning walk than usual. He had not mentioned it because he figured it was just getting older. His wife nodded. She had noticed it too. We ran a full workup. His cardiac output was compromised. An echocardiogram revealed early congestive heart failure. We caught it at a stage where medical management could stabilize and improve his condition significantly. He was started on appropriate medications with close monitoring. 18 months later, he was walking 3 miles a day again. His daughter called my office to tell me he had just danced at her wedding. This was not magic. This was a man whose body had been broadcasting the information it needed to broadcast, and a physician who was trained to receive it. Your body is always communicating. The question is always whether anyone is listening. Now let me give you a practical action plan. Here is exactly how to do a nail health check on yourself starting today. Find a bright light. Natural daylight near a window is ideal. Sit down and extend both hands in front of you, palms down, nails facing up. Look at color first. Are all the nail beds a consistent pink? Is any nail bed pale, yellowish, or has any hint of blue or gray? Note it. Photograph it if you can. Look at shape next. Is any nail curving downward more than the others? Is any nail scooping upward? Is any nail thicker than its neighbors? Note it. Look at the surface. Are there pits? Are there horizontal white lines or bands? Is the surface smooth, or does it have deep longitudinal ridges? Note it. Look for streaks. Are there any dark vertical lines under any nail? If you see one, look carefully at its borders and its width. Photograph it. Now check growth. When did you last cut your nails? Does that time frame feel longer or shorter than your normal cycle? If you see any combination of the changes we discussed today, do two things. Take clear photographs of the affected nails in good light. And at your next medical appointment, hand your doctor those photographs and say, "I would like your opinion on these nail changes." Do not self-diagnose, but do self-observe. That is your role, and it is a role that matters enormously. Do not make these critical errors. First, do not assume all nail changes are cosmetic. The skin and nails are organs. They deserve the same clinical attention as your blood pressure. Second, do not wait until a change is severe before mentioning it. Changes at early stages are far more diagnostically useful. Third, do not photograph only one angle. Capture the nail from the front and from the side. Both views contain information. Within a week of starting regular nail checks, you will have a baseline that makes future changes detectable. Within a month, checking your nails will feel as natural as checking the mirror in the morning. Within a year, you will have given yourself a health monitoring system that runs continuously and costs nothing. So we have just gone through 7 nail warning signs after 65. We covered yellowing of the nail plate and its connection to lymphatic and respiratory health. We covered nail pitting and its link to psoriatic arthritis. We covered clubbing and its association with lung disease and oxygenation. We covered white bands and spots and what they reveal about kidney function and systemic stress. We covered dark vertical streaks and the critical importance of evaluating them promptly. We covered spoon-shaped nails and what they tell us about iron status and thyroid function. And we covered the triad of simultaneous changes that often signals an undiagnosed cardiovascular or metabolic condition. Each of these signs, on its own, can have an innocent explanation, but together they represent a language your body has been speaking since long before symptoms arrived. Learning that language is one of the most practical gifts you can give yourself. My main message today is not fear, it is attention. Attentive self-observation combined with open communication with your physician is one of the most powerful health tools available to you. It costs nothing, it requires no prescription, and it can make all the difference. Here is my challenge to you. Starting tonight, before you go to sleep, spend 60 seconds looking at your hands, really looking. Make it part of your evening routine for the next 30 days. Track what you see. Notice any changes, and bring your observations to your next medical appointment. You are not powerless in your own health. You have eyes, you have attention, and now you have knowledge. That combination is more powerful than you might think. Age does not take away your body's ability to give you information. It simply gives you more information worth knowing. If this video helped you, smash that like button. Subscribe to this channel so you never miss the clear, practical health information we provide for adults over 60. And share this with someone you care about. You might be the reason they catch something early enough to change everything. And now I genuinely want to hear from you. Which of these 7 signs surprised you most? Have you ever noticed a nail change and wondered what it meant? Share your experience in the comments. Your story might be exactly what someone else needed to read today. Take care of yourself.